The following program does not necessarily reflect the opinions and viewpoints of the staff and management of this station.
You shake my nerves and you rattle my brain. Too much of love drives a man insane. You broke my will, but what a thrill. Goodness gracious, great balls of fire.
Senior World Radio presents Bob Cleveland with AMR-7, the miracle-working solution for people who suffer from arthritis and muscle pain. AMR-7 is available from your locally owned family pharmacy, as well as most Homeland pharmacies. If your local pharmacy does not carry AMR-7, please log on to our website, getamr7.com. That's GETAMR7.com. And we will try to make AMR-7 available at your family pharmacy. Now, here's the host of Senior World Radio, Glenn Howard.
And good morning and welcome to a program that offers an awful lot of hope for people suffering from arthritis and muscle pain. I'm Glenn Howard. My special guest today, Bob and Rod Cleveland with AMR-7, the corporation that produces the new breakthrough product that really works for people suffering from arthritis and muscle pain. AMR-7, truly it is the stuff that works. Folks, welcome to the studio. So glad you're with me today.
I'm happy to be here, Glenn. I tell you, I'm excited. I'm pain-free. When you hear Jerry Lee up there singing, I'm ready to get up and twist. That's how good I feel.
Rod, good to have you with me in the studio.
Good morning, Glenn. How are you doing?
Fine. Thanks for coming in. You also have a very special guest this morning with us. Bob, why don't you introduce your guest?
Well, we got one of the top orthopedic surgeons in the state here with us today, Doctor Richard Kirkpatrick, who has a practice in Norman. Dr. Kirkpatrick, why don't you tell us about your practice, where you're located at?
Good morning, guys. How are you doing?
We're off and running.
Good. I'm a orthopedic surgeon. My primary practice is in Norman at Oklahoma Sports and Orthopedics Institute, which is just we've actually purchased a new building just as of yesterday. So we're going to be near the new campus on Tecumseh. But right now we're located across the street from the old Porter Hospital. But we've also got clinics in Oklahoma City, Edmond, and Moore. And so we've got plenty of clinics to see plenty of patients.
Well, tell me, I know you tried AMR-7 and you tried it on some patients. Tell us what have you found out about this?
Well, certainly with orthopedics, and I treat all kinds of muscle and joint and bone injuries, including arthritis, which is very, very common as the baby boomers continue to age. There's more and more patients that are suffering from arthritis, and our traditional treatments, which include surgery and will always include surgery, also include medications and injections and those types of things, which oftentimes are either painful to get, or some patients don't tolerate medications by mouth very well with unwanted or unneeded side effects, and so topical rubs or those types of products are certainly very attractive to us to try to use as a pain reliever and to try to avoid surgery, which can't always be done, but we certainly like to try to if we possibly can. And for AMR-7, I've seen very good early results with that, and have not had any problems or complications or issues that I'm aware of from any of those patients, and we've provided quite a bit of pain relief without surgery or shots or injections or potentially risky medications that you take by mouth.
Well, one thing we found, doctor, is when you're prescribing Aleve or you're prescribing Tylenol, and we've had some talks to some pharmacists about both of those drugs. I know for me, I was taking Aleve, and Aleve ended up kind of messing my stomach up, and then I started taking Tylenol, and that kind of messed up my liver. So AMR-7 worked perfect for me because it stopped both of those issues, and I stopped the pain without taking those type of medicines. What is your experience along those lines?
Well, anti-inflammatories are still a mainstay in treatment for arthritis type pain. The problem with anti-inflammatories, the way that they work, not only work on inflammatory type products or mediators in your body, but they also work on cells in your gastric lining. And so whenever you have issues, some patients are very sensitive to those types of medications, especially if they're taken for a long period of time, to the point where they'll get either reflux type symptoms, or they'll even get GI ulcers or gastric ulcers from taking those pain medications or those anti-inflammatory medications. There have been a new set of medications that were come out that have also been somewhat dangerous, potential problems with the heart from taking a long courses of those types of medications that were intended to be an answer to the GI side effects associated with traditional anti-inflammatories, ibuprofen, Aleve, that kind of thing. And so while we still use those, there's certainly a risk of that, and we have some patients that quite frankly can't take those medications at all because of that. And so the long-term use of anti-inflammatories, even in patients without gastric problems, is concerning to me, and to provide something that's completely safe and topical and does not affect the GI system, certainly a very attractive treatment.
Rod, let's back up just a little bit and begin at the basics. What really is AMR-7?
AMR-7 is a topical gel or topical cream that was formulated by a rheumatologist physician that's located here in Oklahoma City, and he has over 35 years of practical experience. It took him about 7 years to formulate this AMR-7 for his patients, for himself, and he saw that there was a need for a good, effective, safe and effective product. And what AMR-7 is it's a menthol-based product, so it gives you a cooling, soothing effect whenever you put it on your skin. The other thing that is formulated with it is a herb that's called arnica, and arnica is known worldwide for its anti-inflammatory properties, and it's recognized in Europe and has been in use, medical use, since about 1500s. So those are the things that we kind of put together in the formula. So whenever you do put it on, we put it together as a therapeutic levels of arnica and menthol and the other essential herbs, so that you don't have to use a lot of it. It's highly concentrated. Wherever you have your pains and ailments, you can put it right in. It penetrates deep into your tissues, so that gives you the fast soothing relief.
Bob, I've got to tell you, I am really impressed with the people you've had visiting us the last few weeks. A while back, you brought in a pharmacist talking about, in fact, he was a compounding pharmacist who actually makes his own things. And then you brought in a chiropractor who was talking about how his patients use it. Even brought in the sheriff of Cleveland County down there. Pretty good testimony. And now today, an orthopedic surgeon in here saying this stuff works. Man, you've had a home run with this product.
Well, the product does work. That's what people say. The product that works. I know Doctor Kirkpatrick, when we first started out, we were moving a lot of AMR-7 just that first month. There was a lot of talk about it. People were trying it. And I think Dr. Kirkpatrick's office was getting a little aggravated because they was getting a lot of calls. And he doesn't sell it, his office, but he recommends it. But they were getting some calls, and they'd called me and said, hey, tell us where to send these patients to, because they're calling us and we're in our phone line out. But Dr. Kirkpatrick is really one of the leading orthopedic surgeons around. Hey, Dr. Patrick, how often do you do hip replacements? Anything new going on in hip replacement surgery today?
Oh, we do. One of the most common surgeries we do is joint replacements. Probably more knees than hips. That's probably most orthopedic surgeons who do joint replacements experiences. There's more knees to replace than hips. But for hip replacement, boy, there's no happier patient in my clinic than a hip replacement done correctly. And we're always trying to improve the type of implants we're using, the approach that we're using. Probably the hottest topic in joint replacement for hips would be either resurfacing or lesser invasive type surgeries, or what type of bearing surface you're using for hip replacement. But we continue to advance that on almost seems like on a month by month basis. Those things seem to evolve. Again, a big surgery, but for most patients, it's an extremely worthwhile thing to have.
Is arthritis something that does lead to the necessity of joint replacements, or are there most of them caused by other things like accidents or what have you?
Well, arthritis, I mean, I'm a pretty simple guy, and a lot of folks come in and have kind of a misunderstanding about what exactly arthritis is. And the way I explain it to patients is that all of our bones at our joints are lined with articular cartilage. the smooth, white, soft, kind of pliable or flexible cartilage at our joints. And we only have one set of that cartilage. We're born with one set of that. That cartilage does not regenerate. It does not heal. And once it's damaged or injured, it's gone forever. So it's really a pretty miraculous tissue if you think about how long that articular cartilage surface has to last. So its healing potential is very small. So that articular cartilage is there to cushion the underlying bone, and when that articular cartilage is not there, that underlying bone sees stress that it's not intended to see, which hurts because there's nerves endings in that bone. And so how arthritis develops can be from multiple different avenues. Most folks have osteoarthritis or wear and tear arthritis. A lot of folks have rheumatoid arthritis, which is inflammatory. You could have traumatic arthritis if you had a motorcycle wreck and broke your knee joint and it broke that cartilage. That's a way that could have happened. So the end result in all arthritises is basically the same. The loss of the cushion at your joint, which exposes the bone underneath, and those nerve endings in that bone see that as pain.
I'm Glenn Howard, Senior World Radio with Bob and Rod Cleveland, and our special guest today is Dr. Kirkpatrick, an orthopedic surgeon. We're talking about that wonderful product called AMR-7. We've got to take a break, but we're coming right back, so stay with us. You're going to hear more from Dr. Kirkpatrick this morning.